Welcome to this edition of Aesthetic Insider. I'm pleased today to have as my guest Joe Proctor, the CEO of Bellus Medical. Joe, welcome to the program.
Thank you for having me, Steve.
Can you tell us a little bit about microsurfacing or the skin pens that we're hearing about? There's been a lot of talk about it in the industry for the last few years, and I know there's been some controversy. Can you shed some light?
Sure. You know, our device is skin pen microneedling device, and it's designed to really help with facial acne scars. That's what our indication is. And in this space in general, it's been a little bit of a gray area because a lot of devices came on the market and they filed or registered with the FDA as a Class 1 medical device. And with the FDA, they've really made the decision that this is a Class 2 medical device.
And can you explain a little bit about the difference between Class 1 and Class 2?
Yeah, so anytime you have a Class 1 device, that's just as an example, it could be a Band-Aid, right? So a very simple medical device, doesn't have any structure or function claims as far as the way it works with the body. Class 2 medical device is going to be something that has a structure function claim. So as you can imagine, microneedles puncturing the skin is going to affect the structure and of course possibly the function.
And what's the benefit of having a device that goes down 2.5 millimeters?
Well, I think if you're looking at the indicated use, which is acne scars, depending on what the depth of penetration is necessary to be able to actually get the efficacy of the treatment, you want to make sure that you have the ability to get down to that depth, break up that scar tissue, and really create that remodeling opportunity.
Now, do you have studies that backs these claims?
Absolutely. In fact, because we've filed a de novo 510K and really been the first technology to work through that process to create a new classification with the FDA, we had to do a clinical study to be able to prove the safety, and then B, of course, the efficacy of the treatment.
So there was a time period when a lot of them were being sold, and then the FDA put a moratorium on them, if I remember correctly, or they stopped them being sold.
Well, I think the thing that's important to understand is the FDA is out there and they've made a ruling. They put out a draft guidance in September of 2017 that really says that these technologies are a Class 2 medical device. They need to work through this specific process in order to have the right to sell it on the market. Unfortunately, there's a lot of companies out there that still, bring their technology to market. They're not working through the typical process.
So you're going for acne scarring. What about wrinkles or skin rejuvenation? I guess it's kind of difficult to go after that indication, but is that something that you would consider?
So absolutely. We felt like in order to do the initial study, we wanted to really attack something that had a real significant need in the medical aesthetic space, and that's why we went after acne scar. But after that, we were looking at possibly doing a retrospective study, looking at the treatments that have been done and maybe getting that indication for fine lines and wrinkles. Outside of that, we have several other studies that we're looking at for other applications that we think that could be compelling with this technology.
So let me ask you a question. Laser devices are so expensive. Do you see yourself competing against laser devices?
That's a good question. I really don't feel like we're in the same ballpark as the lasers, and several laser technologies have different applications that really don't impede on what we're trying to do with microneedling. But one thing that's, I think, important to consider is our technology really isn't doing the same thing as laser. It's not a thermal injury. It's a mechanical injury. And the thing that's really beautiful about the mechanical injury is you can do it, for several treatments and get a really great result, and then come back and do it again next year, and then the next year, and then the next year. And there are no negative side effects to doing that treatment over and over and over because it is a mechanical injury. It's not chemical or thermal as far as the damage. And the wound healing cycle is one that rolls down a non-inflammatory path that really is beneficial to the patients long term.
I want to ask you one last question before I let you go. So I understand you played baseball in college.
I did, yes. Yes, I did.
Who's your favorite baseball player?
That's a good question. I think probably if I think back, Nolan Ryan is probably my favorite baseball player. And the reason why that is he's just absolutely excellent. I don't know if you followed him much in his career.
Him.
Yeah, okay. So he had 7 no-hitters, right? What people don't realize is he also had 12 one-hitters and 18 two-hitters, right? So, he was one hit away from, potentially having 19 no-hitters. That's pretty dominant.
And longevity as well.
Of course, right? Yeah, which is amazing. He was a machine. So, yeah, it was fun to watch him play.
All right, well, watch more Cubs this year. They're gonna do it again.
Hey, no kidding. Well, congratulations. Of course, that was really special.
Yep. Well, thanks so much for being on the program. We look forward to seeing you.
Absolutely. It was my pleasure. Thank you very much.